So welcome to Paget's Awareness Day 2025. Now, the focus of Awareness Day this year is the need for early diagnosis of Paget so that condition can be picked up and treated appropriately. And today I'm joined by Dr. Cat Nairn, who's a GP based at St Triduana's practice in Edinburgh. And Cat developed an interest in Paget's when she was a trainee in Edinburgh and is a former trustee of the Paget's Association. So welcome, Cat.
Thank you very much.
Okay, so Kat, the feedback I've heard from many patients when they come to our information days is that many GPs have never heard of Paget's disease and are not quite sure what to do if they come across a patient who may have the condition. So what's your approach? What would you say to that?
So I think it's important to remember that GPs are generalists rather than specialists, and we deal with lots of different conditions. Paget's disease of bone is relatively rare. With patients, only about 1 in 1,000 patients having it. So in a list size in a general practice, there's maybe only 2 or 3 patients registered who might have this condition. However, GPs through medical school and their training will have been exposed to this and should have it on their radar when patients present with possible findings or symptoms of Paget's disease of bone.
Thank you. So, as someone who is aware of Paget's disease, obviously, what would be your advice to a GP who thinks they may have a patient with a condition, say, for example, an X-ray shows something? Over to you.
Yes. So during my time working in rheumatology, I actually published an article in the British Journal of General Practice guiding GPs on how to manage Paget's disease of bone. I think the 3 main take points from that are the ways in which Paget's disease might present and to put it on GP's radar. So firstly, it might be found in an incidental finding when a patient is having a scan for other reasons or for pain, and the radiologist reports that this appearance is in keeping with Paget's disease of bone. The second is when a patient might have a blood test carried out for various reasons, and we see a raised alkaline phosphatase ALP test. And the third is when a patient might present with bony pain, particularly around the hips or back, and in elderly patients. And we should think about Paget's disease in that position as well.
Okay, thanks, Kat. So imagine the scenario where maybe the X-ray suggests Paget's or the ALP is high. What would be your next course of action for that type of patient?
Yeah, so I think it's important to correlate with the patient's symptoms and how they present. But if suggestion of Paget's disease, then I would be referring to the specialist to allow them to decide whether they feel it is the case and whether any treatment is relevant to this patient.
Excellent. And in the situation where maybe there hasn't been an X-ray or there hasn't been a blood test, but they've got a bit of pain, pelvis, or what would be your approach then?
Yeah, so I guess as GPs, we're used to looking after undifferentiated patients presenting with symptoms. So as part of a workup for somebody presenting with pain, we might be doing more tests to look into that, particularly those presenting with pain which isn't improving with the simple measures. So I would therefore carry out blood tests or X-ray scans as part of that workup. If those blood tests and X-rays were completely normal with no mention of Paget's, then it pretty much rules it out. But if there's any suggestion of a raised ALP or an abnormal scan, then I'd be referring to the specialist for their advice.
Okay, great. Yeah, I suppose that's sensible advice because you wouldn't really be treating it in primary care. Very
Yes.
clear advice, Kat. Thank you. So I hope there are some GPs listening to this because I think you've given a masterclass on Paget's disease for the GP. We'll have to put a link to that article you mentioned in the British Journal as part of the Awareness Day package. So, Kat, thanks again for taking the time out of your busy schedule to speak to us today. This has been a great interview, and I think you've shown that it's not all that hard to deal with Paget's if you do suspect it, and there's a clear path ahead. So thanks once again.
No problem. Have a good day.
Thank you.
Bye-bye.